Hello again. This is your second pre-brief video for your patient simulation encounter for GenMed Lab that will happen this Thursday at noon at the Prisma Simulation Center. You have all that information already, so please make sure you are on time. This video is predominantly to discuss key information that is pertinent to the upcoming case. So we will begin with the case. You are co-certified athletic trainers at Cypress College in Taylor Coliseum, where you both provide healthcare to the student athletes. You and your co-AT are in the athletic training facility hosting open clinic hours while some of your sport teams have practice in the gymnasium located in the Coliseum. You have created a list of medical red flags for the sports that are currently ongoing as you oversee multiple sports. So this is what that looks like. You have, for your winter sports, you have 3 patients in the men's basketball team with previous medical history of type 1 diabetes, exercise-induced bronchospasm, allergies to bees and peanut butter, and then 2 females in basketball with asthma and exertional heat exhaustion. There are some family history as well that you need to be aware of. So please make sure you review this information and that you are aware about the conditions of your patients, as this could put them at risk for further medical needs if they were to have some sort of episode dealing with their current medical condition. If something were to happen, your emergency action plan for the Taylor Coliseum is here. You have the personnel and the emergency contact information along with EMS phone number on here and the address to the location. So please make sure that you are aware of the procedure in this emergency action plan, along with who you need to be calling if something were to happen, and then the venue directions as well. I truly strongly suggest and urge you to make sure you review this information that was provided. The encounter will be set up to be in the Coliseum, and you will have your emergency action plan posted, but please make sure you review prior. Again, if you have any questions, please feel free to reach out to Dr. Winkleman or myself via email or on our cell phones. We will see you on Thursday.